Hello, we're going to be talking about intubation. First thing we need to do is gather our supplies. Here are our supplies. Need to make sure that we have suction canister set up and turned on. An ambu bag ready to go with the mask on. Set the flow meter to flush. Make sure that your bag is inflated. You also need an ET tube based off of the physician's orders, a 10 milliliter syringe, lubricant, a manufactured holder or twill, a laryngoscope blade and handle, you can see here that this is where a blade will be labeled, is on the back side. Happens to be a Mac 4. A stylet, a Yankar, which we already have set up over there. An end-tidal CO2 detector. Notice that this is an old one. When you first get this out of the bag, it's going to be purple, and it will turn yellow to show positive CO2. And a cuff manometer. Okay, so we're going to get the ET tube ready to go. You're going to need your stylet, your lubricating jelly, your ET tube, the size based off of what the doctor ordered, and your 10 milliliter syringe. Trying to keep things sterile, we're going to keep the tube in, open up this end, get your pilot balloon out, get a full 10, plug it into your pilot balloon, and then you're going to inflate the cuff to ensure cuff integrity. If the cuff does not maintain air, it is a bad tube. It needs to be thrown away and a new one gotten out. Once you've checked your balloon or your cuff, deflate it. Take all the air out by repeatedly withdrawing air until the pilot balloon is flat. You'll see that there's no air. Next is to get your syringe ready to go for intubation. Pull it back to 10 milliliters. Set it aside for the moment. Take the stylet, introduce that into the tube. You may have to bend a little bit as you go. And now you have a tube with the stylet to give it rigidity, and it's ready to go. Notice that you have this ready so that when it's time, you can pull out. Some doctors like a little bit of a bend to it. That's the way it should look. Next, you will take a little bit of your lubricating jelly, just tear a corner off, and maintaining integrity of your sterile tip, you're going to put some jelly right here. Bring your tube up and mix that. Get your tube lubricated and then return it to the end. This is ready to be used for intubation. Keep this close by. Once the doctor takes it, you're going to want to connect this, and that's it. Next thing we're going to do is get ready with the laryngoscope. Make sure that you have the blade that the doctor asked for. The first thing we're going to check is to make sure that we have a good battery and that the light is working properly. These only go on one way. We'll notice the peg and then the accepting slot, click, and then you'll see the light comes on. It's solid, it's not moving. This is good to go. In order to conserve battery life, you just fold it up, set it aside. This is ready to go.
So if you were doing that and it stayed purple, what would that mean?
If it stays purple, it means you're in the belly.
That's right.
Or at least in the esophagus, but you're filling the belly up with air. At this point, you'll have someone assist you with bagging while you get ready to secure the tube. Never take your fingers off the tube. Always make sure that you keep it at the position that the doctor placed it in, and that you have good colorimetric. The next step is to do the auscultation. Alright, so we've already done our colorimetric. We made sure that we have CO2 return. Now we're going to auscultate to make sure that we have bilateral breath sounds, because you can still get CO2 return and be in the right main stem bronchus, which would be detrimental to your patient. And then lastly, check for your cuff leak by auscultating directly over the trachea. Cut. Cut! Alright, next we're going to place a manufactured tube holder. Maintaining proper ET tube depth. Also keep in mind that during this time somebody's going to be bagging, so there's going to be a lot of hands right here, but you just kind of have to establish your place and get the tube secured. So you're going to have nurses, techs, sometimes doctors helping to hand you things if you don't have them within your reach. This is one type of manufactured tube holder.
The worst type.
It's not the worst type. I've found worse. But this is an easy one to use, and a lot of times you'll find this being used out in the field, and you'll see that it also has a built-in bite block. So you're going to make sure that you get the bite block put in between the teeth, maintaining your tube depth. And then this just has a screw tightener. And you're going to get that tube right in there, and you're going to screw until it's secure. Don't over tighten it. Make sure that your cuff is in this opening so that it can be moved around and adjusted as needed. This comes with a handy little paddle. You're going to push that underneath the patient's neck, catch it out the other side. Always making sure that until this is secure that you're keeping a hand so that this does not get removed. Through the other side, up. And secure. And now you're free to remove your hands. That tube's not going anywhere. You can pull and do all sorts of things, and it's secure. And that is one type of manufactured secure tube holder. Okay, next thing we're going to do is we're going to show you how to twill. So you're going to need a length of twill. and then you're going to need a short end and then a long end. Make yourself a loop, and don't forget at this time you're going to be maintaining the tube, so you're either going to have a nurse or a tech or somebody helping while you need your hands. It's always helpful if you've got a second RT available. First thing you're going to do though, you'll take your loop, keep a finger there, come around, so I have the loop and the extra. I have my short end, my long end. Notice I've not done anything yet here. You're going to take both sides up through the loop, and then you're going to pull tight, and then I'm going to tie a knot, and I'm not going to tie this as tight as I normally would because we need to get this twill knot back out. Tie a second knot, and now what you have here is you have your loop, you have your lengths out, but now you have this knot that's acting as a stopper. So this can move, and this is going to keep it from sliding. Take your short end, long end. It's going to go the knot up here up at the top of the lip, long end around the back of the head. And now that I've got secured with my hands, I can let go of the tube and tie off. Some considerations when doing twilling is making sure that you don't get people's hair caught into the knot, and that you're not pulling so tight that you're pinching their skin. Alright, and that's it. You take a pair of scissors, cut off, and as needed, sometimes you can use another piece of twill, or you can use some places will use like a trach holder, and they'll put here and here and wrap over the top of the crown of the head to lift this up and to keep some pressure, make sure that that stays on top of the lip. And that's twilling.